Hey guys, my name is Jordan, and today I am going to be talking about vitamin B12 deficiency. So, the chief complaint in this case study, the patient states, I've been feeling terrible for nearly 6 months. Lately, I've been having problems talking and some difficulty with concentration and remembering things that I did yesterday. I've also had some numbness in both of my legs, and sometimes I have trouble walking. I think all the booze and all those 8 balls have finally taken a toll on me. I'm feeling old, and I know that I have to change before it kills me. History of present illness. This patient is a 26-year-old Caucasian male presenting with pallor, fatigue, a 2-day history of difficulty expressing thoughts, difficulty with concentration, and having some short-term memory issues. The patient has a 3-month history of bilateral lower extremity numbness and weakness. This has also caused some difficulty with his gait. The patient reports a shooting pain that starts in his neck and then goes down into his back and both arms. So, a little bit more about vitamin B12 deficiency and the anemia that this leads to. So, a decrease in vitamin B12 in this specific case is due to excessive alcohol that decreases the absorption in the stomach. And then medications for heartburn and diabetes can decrease absorption. And this patient has been taking famotidine for the last 2 years for heartburn. And vitamin B12 deficiency is related to decreased absorption, is called pernicious anemia. And then vitamin B12 is necessary for the production of healthy red blood cells, white blood cells, and platelets. And also, it's really important for proper central nervous system functioning. So, some of the symptoms that you can see in patients who have a decrease in vitamin B12: tingling, pain, gait issues, confusion, memory loss, weight loss, glossitis, depression, irritability. And this patient has a lot of these symptoms. So, the epidemiology: 1 to 2% of all anemia is because of a B12 deficiency. And among the patients that are diagnosed with macrocytosis or megaloblastic anemia, 18 to 20% were due to vitamin B12 deficiency. And there's obviously an increased prevalence in the elderly population. So, the pathophysiology in this case study: essentially, with a healthy person, vitamin B12 binds to R factor, which is actually found in the salivary gland secretions. So, this new complex that is formed goes and it reaches the small intestine, where B12 is then separated from this R factor by these pancreatic enzymes. And this allows a new complex to be formed. This is B12 and intrinsic factor. And then this new complex binds with receptors within the ileum. And then this is what allows for the absorption of B12, which is really important for hematological and neurological function. A lack of B12 prevents the conversion of homocysteine to methionine. And this, in and of itself, slows down DNA synthesis and leads to that megaloblastic anemia. And this is a really important part of this pathophysiology. This impaired DNA synthesis also impairs this nuclear division that's going on, and it leads to nuclear cytoplasmic dyssynchrony. So the cytoplasm matures at a completely normal rate, but the nucleus, having that impaired DNA synthesis, does not mature or fails to mature fully. So furthermore, a lack of that B12 also prevents methylmanoic acid from converting to succinylcholine. And then this is also what contributes to that myelin damage, and that's why you're seeing some ataxia and some neuropathy and things like that. And we'll talk about this a little bit later in our lab values. So, megablastic anemia is not only linked to a decrease in B12, but also to a decrease in folic acid. So, this specific case study, the laboratory findings: this patient has low hemoglobin, hematocrit, red blood cell, platelets, white blood cells, right? And this all makes sense because the body is just not able to produce these because there's not healthy cellular reproduction occurring. So you've got these high MCV and MCH. That's why we're talking about megaloblastic anemia, this increase in size. And then obviously this patient has a low vitamin B12, ding, ding, ding. And we also see this low folic acid, which, as we talked about, in and of itself can also be a cause of megaloblastic anemia. So we see this high bilirubin, and in the case study, we see that this patient does have mild jaundice. High MMA, this is related to that lack of conversion to succinylcholine. And then that high homocysteine is also a lack of conversion that occurs with this. The blood smear test, this shows anisocytosis. So this is when red blood cells are different sizes. And then this next word, I'm not even going to try to pronounce, is basically an increase in the percentage of abnormal red blood cells. So you've got these giant platelets and then macrocytic red blood cells. And in the physical exam, we see that this patient has had weight loss, is undernourished and underweight, is slow to answer questions. So we're seeing those the effects of that decreased myelin sheath. And then tired, restless, pallor, obviously low hemoglobin, hematocrit, red blood cells, platelets, so they're going to be tired, they're going to have pallor. And then this beefy red tongue, glossitis is a common symptom. And then this unsteady gait, like we talked about, the effects of that myelin sheath, disruptants. And so relevant patient history, like we said, is that excessive alcohol use, which decreases the body's ability to absorb that vitamin B12. This patient also talks about his nutrition, and it is poor. His diet lacks meat, dairy, fresh fruits and vegetables. These are all the main sources of vitamin B12. And like we mentioned earlier, this patient has taken famotidine for 2 years. This is a proton pump inhibitor. This, as well as medications used to treat diabetes, can affect absorption of vitamin B12 within the body. So, Christian worldview. I was listening to a really great sermon. It's a short sermon by John Piper, and he was talking about the core of a Christian woman and how it's based on 3 things: an unrelenting hope in God, that's the foundation for everything, and a sense of fearlessness and adornment of the innermost part of herself, her spirit. And in the verse, it talks about how this adornment of the innermost part of herself is precious to the Lord. And meditating on the word, that leads to this beautiful discernment and this outflow of the Holy Spirit when we have to have really delicate conversations with people. Someone who's struggling with alcohol abuse in this situation and who's feeling really bad all the time. These are hard conversations. And so asking for discernment and just being so in touch with the Holy Spirit, meditating on His Word day and night, so that you are just so in tune that He is just absolutely flowing out of you into everything that you do, into your conversations, into the wisdom that you give your patients, and that is such a beautiful thing. And also just on the outlook on the world that we have with the knowledge of all of the health issues that are going on. It's really hard to see day in and day out. We all know that as nurses. And so having this unrelenting hope in God and this sense of fearlessness, God is so good. God is so good to provide us with that insight. And that's a beautiful thing, to have hope in the midst of that. Some of the case study questions, we kind of talked about this, but what other vitamin deficiencies can cause megaloblastic anemia? And what is the treatment for this diagnosis? Should it be short-term? Does it need to be long-term? And then what causes that glossitis, which is a really common symptom? And here are some of my references. And that's all I've got. So thank you guys so much.